quick story. My story. Well, part of my story. A few years ago, I had a serious problem with my gallbladder. Everybody has gallstones. Mine were really bad. Anyhow, I went to the hospital 4 times. And I'm not the type of person that goes to the emergency room willy-nilly just because something hurts. I went because the pain was excruciating. To the point where I felt like I was dying. I mean, I seriously thought that was it. And it would have been it if it hadn't been for one good doctor. Anyhow, I went to the hospital for the first 4 times, and they didn't even listen to the symptoms very well. They just heard I have a pain in my abdomen. That was it. They ignored everything else about it. They ignored what I had described before it happened. They ignored even the fact that this pain had been something that was recurrent. And I mean, it was recurrent. I've encountered the same pain several times before, and it wasn't bad enough to actually care about it. So I didn't really worry much about it. Didn't even call the ambulance, nothing. But the 4 times I went, and they did nothing, and just diagnosed it as IBS. On the 5th time I went, I had a doctor that was actually paying attention. Actually listened to the whole story, everything that I told him. What I had eaten before it happened, everything. How long it'd been lasting, and by this time it was so bad that I could barely breathe. The pain was that bad. I couldn't sit still, I couldn't lay down, I couldn't do anything. I was literally just kind of rolling on the gurney. I couldn't move, I couldn't stop moving, because every time I stopped moving, it would hurt even more. And it was hard to breathe. That was the other thing I remember. Anyhow, he paid attention to it, and he thought, well, I've heard of this. I've heard of these symptoms. I've heard of this happening before. So let's check you for your standard main organs failing or something like that, like everybody else does. And you've probably been through already. But we're also going to do one other test, sonogram. Now it turns out I did have gallstones. Really, really bad gallstones. Same hospital I had a hard time getting into surgery because I had to spend at least a couple weeks looking up everything about the surgery I possibly could, so I understood what was going on before I would say yes. I wanted to know everything about it. And the surgeons at the hospital made it sound like it was not something urgent, like it wasn't that important, that I could just watch what I eat and all that. Turns out it was a lot worse than that. So when I finally agreed, okay, let's do the surgery, because the pain was starting to become regular, daily. Not excruciating pain, but just a pain in that specific area that was starting to feel really sharp whenever I laid down. Well, the doctors, surgeons, never contacted me back. They were dragging their feet. So I went to my GP and I said I want to go to a different hospital. And I named one that I had had really good experiences with. Every time I'd gone there for an emergency, they actually looked into it, listened to everything I said, all of that. So I go and see the surgeon there, and the surgeon there says, yeah, we need to remove it. I'm like, it's that bad. He's like, yeah, it's that bad. So we made the date and everything, and I was expecting the 3 little incisions that are normally common with it. I didn't expect anything to go seriously wrong, honestly. I mean, I understood what it would be like if something went seriously wrong, but I was hoping and expecting it not to. because I'm usually really good at catching serious ailments before they become serious ailments. I mean, I know my body. I also know my pain tolerance. Pain tolerance is extremely high. So I get things taken care of as soon as it surpasses my pain tolerance. Several other aches and pains that I've never even told the doctor about. The doctor doesn't even know about my knee because of a bike accident. Anyhow, back to the gallstones. Going for the surgery, I'm scared out of my mind as it is. I'm going to have somebody be opening me up, having stuff put inside of me to freak me out. Anyhow, I wake up and I have this huge cut. Of course, it was stitched up, but this huge gash all the way across my stomach. Well, not all the way across my stomach, it goes up and down the length of my stomach. And of course, I freaked out. Nurses were really nice. Nurses are usually pretty nice. I like nurses. And eventually, I finally got a small gist of what had happened. There was some internal bleeding because he couldn't remove the gallbladder correctly or something, so they had to open me up. Of course, I was kind of a little worried about that. I was like, oh crap, what kind of surgeon did I get? Then I saw the surgeon to have the stitches removed. Well, the staples. When I went in to have the staples removed, he says that on the bright side, I get to brag and say that it was the most number of gallstones that he had ever seen in his entire career. We're not talking about a young surgeon either. He was probably 60s, 65 I think, somewhere around there. He'd been practicing for well over 30 years. And my gallstones were the worst he had ever seen. The gallbladder itself had managed to start fusing with the liver, the pancreas. I always get those two confused. And the gallstones were starting to work their way into the other organ. So when he removed it, he had to leave a piece of the actual gallbladder on the other organ to get out all the gallstones. I was that close to death. The gallbladder would have ruptured on its own if it hadn't been taken care of within a couple of months. It might have made it a year before it had happened, but it would have happened soon. 4 doctors missed this because they completely ignored the symptoms. They completely ignored the signs. And they treated me like a typical hypochondriac patient that they created in the first place. They turned everybody into hypochondriacs. Now everybody goes in, simple cough, and everybody thinks that they're sick. So they go into the emergency room. So the doctors in turn then treat everybody like they're hypochondriacs, like they're exaggerating the symptoms, without even considering the history of the patient. The one hospital that does the emergency room doctors there do actually consider the history of the patient. The one that I got the surgery at. That's the reason why I chose them. I thought it was just a rare thing. I thought it was something that was uncommon. Maybe just one bad hospital out of the entire country or something. I just happened to pick the one bad hospital. It's not as uncommon. It's very common. There are patients dying of preventable causes, not because they can't afford health insurance, not because they can't even afford health care, even though that is a problem. I mean, the fact that you need health insurance to pay for everyday health care is wrong. There's something wrong with that. But because the doctors are stereotyping patients, ailments, diseases, everything. The reason the other 4 doctors had not considered it was because gallstones are considered a big person's problem, a fat person's problem. It takes a lot of pain before I even tell a doctor about it. I've got aches and pains all the time. I get migraines. No doctor has ever known that I get migraines. Patients, start demanding your doctor actually listen to the symptoms. Don't accept any diagnosis. Don't sign anything until the doctor actually sits there and listens to you. Doctors, stop stereotyping. You're killing us. You're the problem. You and your administration are the problem of the medical industry in the United States. Health insurance, the fact that we need health insurance to pay for you guys, that's the problem. Now, in an emergency situation, yes, health insurance fits. But if you're going in for an everyday checkup and you need to take out a loan for a checkup, stop it. Okay? Start caring about your patients again. Start loving your patients. Start caring about humanity. And stop with religious stupidity. Stop with stereotyping. Stop with prejudice. Because you are the problem. And don't think that it's not going to go unnoticed anymore. Thanks to the internet, it's now really easy for people to search and find out how many times misdiagnosing has caused serious problems. Overdiagnosing has also caused serious problems. You need to triage better. You need to find the people who are not complaining about simple aches and pains and take their aches and pains a little more seriously. And the people who are complaining about aches and pains that are not important, you need to figure out who they are. Look at the records. That's why you keep medical records in the first place. You can look at the background of each patient and ask a patient to sign over their medical records from another doctor. Most of the ones that are truly looking to be helped will say, yes, here, look at my medical records. Tell me what's wrong. Of course, if they say, no, I don't want you to see my other medical records, then yeah, you can pretty much say, well, then I'm not treating you because I don't know what's going on. But we need a medical database that you all access, and you all need to read the medical reports. So stop killing us.